Hello, and welcome to Dermatology Weekly, the official podcast of MDedge Dermatology, where we discuss issues that most affect the specialty. I'm MDedge editor Elizabeth Mishkati. And now, your host for this week's Peer-to-Peer, Dr. Vincent DeLeo.
Today, we are talking to medical student Lauren Schwartzberg and her colleague, Dr. Ann Lin, about the cutaneous manifestations of COVID-19. Can you both please introduce yourselves for our listeners?
Hello, Dr. DeLeo and everyone who's tuning into the Cutest podcast. My name is Ann Lin, a third-year dermatology resident at St. John's Episcopal Hospital. It is my absolute pleasure to be here today with Lauren and go over our paper, Cutaneous Manifestations of COVID-19. I also like to give a special thanks and shout out to Dr. Jarizo, our senior author.
Hi, thank you all so much. My name is Lauren Schwartzberg. I go to NYIT-Com, where I'm a fourth-year medical student. Thank you for having me.
Thank you both for joining us to discuss this great paper that you published about the clinical manifestations, dermatologic manifestations of COVID-19. So let's get started. In your article, you gave us an overview of the cutaneous clinical signs of COVID-19, which were reported in the literature. Which of these cutaneous manifestations were most commonly reported?
Dr. DeLeo, I'll take that question. So in the 25 articles that ultimately met our inclusion criteria for our review paper, we found that the most commonly reported cutaneous manifestations were chilblains-like lesions, urticaria, erythema multiforme-like rash, vesiculopapular rash, morbilliform eruptions, and purpuric eruptions. Of course, as the data is constantly being updated from the literature as the pandemic evolves.
So in your really extensive examination of the data, you note that there are certain cutaneous signs that differ based on age group, adults versus children, and also how the timing of the onset and prognosis is related to the type of cutaneous signs. Can you discuss those two things with us?
Yes, so in children, chilblain-like lesions are the most common cutaneous sign, and they might be the only presenting sign of infection. Urticaria has also been reported with both asymptomatic and severe infections in children, and the onset of the urticaria ranges from being the only presenting sign to 1 month after symptom onset. So it's really hard to tell at this point what the prognostic factor of that is right now. In adults, it appears to be more common to have a morbilliform exanthem in mild or asymptomatic disease. And with more intermediate severity of disease course, a vesiculopapular eruption is more commonly reported in adults. Lastly, in severe infection in adults, a purpuric eruption is most common, and the timing of this can vary significantly. But for more severe infection, it's been reported to appear after 20 days after symptom onset. And in more mild cases, a morbilliform rash might be the first and only presenting sign. So it's important to identify this pattern, but we really need more data and more literature to make conclusions about what the disease course will be and how we can improve medical management from there.
I think you've covered the more common kinds of cutaneous manifestations that are seen in COVID-19. What about more rarely reported skin manifestations that you found in the literature?
Sure, the more rarely presenting skin signs included androgenetic alopecia, periorbital dyschromia, mottled skin, and herpes zoster exacerbations. They were found to be associated with COVID-19 infection. So the androgenetic alopecia is thought to be due to an androgen regular receptor named TMPRSS2. This is used by COVID-19 virus. However, in the reports available, it's difficult for us to discern the onset of androgenetic alopecia in relations to COVID-19 infection. Of course, more data is needed to determine this association. And in mottled skin that we saw in the literature, this was related to vasoconstriction or changes to the blood flow in the involved vessels. In a case with a newborn, the mottled skin presented along with sepsis due to the COVID-19 infection. Periorbital dyschromia has been reported as the first sign of COVID-19, which spontaneously resolved along with the viral infection. The mechanism of this skin finding is still not well known. And lastly, herpes zoster has been reported to last with a severe post-herpetic neuralgia despite appropriate treatment. We think this is likely due to exaggerated immune response caused by COVID-19 from our literature analysis.
That's very interesting. Now, I think in your report, you point out that many of these manifestations are seen in patients who are already diagnosed with COVID. What did you learn about what dermatologists could look for in terms of clinical presentation that might help the patients with COVID-19 who haven't been diagnosed with COVID-19 at the time that the dermatologist sees them?
I think it's important to look at the unexplained rashes a little differently now than ever before the COVID era. When a patient presents with any of these signs that we've mentioned today, chilblain-like lesions, idiopathic urticaria, or a vesiculopapular exanthem, a thorough history of COVID-19 exposures and perhaps even COVID-19 testing should be considered. And then also precautions should be taken for these patients to reduce infectivity.
I think that's a great recommendation. Getting more into the pathogenesis of the skin manifestations, did you learn much about what we know about the pathogenesis of the manifestations? And are there indicators of more severe disease?
As far as we know, COVID-19 targets cells of the airway tract and it binds specifically to the ACE2 receptors. And then it enters the cell by hijacking the host cells for mass replication. And the downstream effect seen is an upregulation of the immune response, which can also involve multiple organ systems. This also leads to inflammation, dysregulation of the immune system, hypercoagulable states, vasculitis, and vasculopathies, which reflect the cutaneous manifestations we've seen. The hypercoagulable states induced by COVID-19 infection, it's likely responsible for the skin manifestations that we've seen, specifically livedo reticularis and the acral ischemia in children. In adults, the acral cyanosis is thought to be caused by insufficient type 1 interferons. Since these interferons are necessary for an antiviral response, this may be associated with more severe infection in adults with acral ischemia. But it's too soon to make a definitive conclusion about the predictive values of these cutaneous signs and their pathogenesis. More papers need to be available for us to reference and also will help us reevaluate the significance of the skin lesions in COVID-19 infection.
That is an excellent discussion of the cutaneous manifestations, pathogenesis, age differences. So what, as dermatologists, I mean, we're the experts of the skin. How can we do a better job to educate our patients and our colleagues who are in other areas of practice?
Dermatologists can educate patients and colleagues of other specialties on the potential clinical significance of the cutaneous signs of COVID-19. Being aware of these common and less common manifestations can help in early diagnosis and thus better treatment options. And educating patients that if they have one of these signs, perhaps they should quarantine or get tested before interacting with others or other household members to possibly prevent further spread of the disease.
So I recommend that all of our listeners go to the great article and look at the wonderful tables in the article, Cutaneous Manifestation of COVID-19 by Schwartzberg, Lin, and Giurizzo. Thank you for joining us today.
Thank you, Dr. DeLeo, and our cutest audience. Have a great day.
Thank you.
Thanks.
That's it for this week's episode of Dermatology Weekly. The peer-to-peer portion of the show is produced by MDedge editor Melissa Sears and editor Alicia Saunders. All of our podcasts are produced by an MDedge editor, Kathy Scarbeck. I'm MDedge editor Elizabeth Mishkati, and this is Dermatology Weekly.